everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be going over a couple of possible scenarios that could come up during medication administration and the right way and the wrong way to handle them. So let's get into our first scenario. Here's your beta blocker for your hypertension, Mrs. Johnson. Hyper? I'm not hyper, and I don't have a beta fish. So in this situation, what the nurse did wrong was to use medical terminology, medical jargon. Likely the patient doesn't understand these terms, so it's very important that we say things in terms that they can understand. In the United States, most people have a literacy level at about 5th grade. And our health literacy level, so what we understand in terms of like healthcare related things, is even lower than that. So keep it simple and use words the patient can understand. Here's your procardia, Mrs. Johnson. Oh, that's okay. You could just put it in my hand. Thank you. Whoops! Oh, I dropped it. Whoops! That's okay. I got it. Dust it off. 5-second rule. It's fine. You can have it. So obviously this is not what you're going to do in this situation. The first thing being, we never put meds like loose pills in somebody's hand because there is a potential they could drop them. And if they do drop them, we're not going to pick them up and expect them to take a med that's been on the hospital floor. Because as clean as our hospitals are, it's the floor, it's dirty, it's gross, right? So what happens if they do drop a med? You are to get rid of that med, discard it, and then go get a new med. These are all your 8 o'clock meds. Thank you, nurse. I don't want my water pill. Do you know which one it is? I'm not quite sure which one it is. Maybe this one? In this situation, what the nurse could have done better is to individually open these medications and explain what they are as she's doing it. So go to the bedside and say, this is your pill for this. Open it, give it to them. And when you got to the water pill, the patient can say, oh, I don't want that one, I'm refusing that medication. The nurse will not have even opened it yet, and then she can go ahead and return it to the Pyxis. Here's your Zyrtec, Mrs. Johnson. Oh, I thought I was on Zantac. Oh no, I gave her the wrong med. This is another situation where just doing the 6 rights and the 3 checks are going to help you avoid these kind of mistakes. And unfortunately, these do happen. We do have a lot of look-alike, sound-alike meds. We try to differentiate them and tell them apart so this doesn't happen, but errors do occur. So if you're doing those 6 rights, if you're doing your 3 checks, this shouldn't happen. So I saw in your chart that your last blood pressure was 80/60. That must mean your medications are working. Here, go ahead and take another blood pressure pill. So it's okay to take my blood pressure medicine when my blood pressure is low? Certain types of medications do have parameters on when to give and when to hold. So it's very important that the nurse knows what those are. If the patient's blood pressure is too low, then we are to hold antihypertensives. If they have diarrhea, then we are to hold a stool softener. So giving them something they don't need that could potentially turn into a dangerous thing is something we need to know about. A quick note about antihypertensives. When you do give that medication, you want to make sure the vital signs have been done very recently, within like a half an hour prior to administration. So if you have a med due at 10 a.m., you cannot use the PCT's vitals that they took at 7 a.m. That's too long. So it needs to be very recent before you can give that med safely. Here's your medications, Mrs. Johnson. But I don't want to take it. Well, I don't really care if you don't want to take it. I'm the nurse and I'm telling you you have to and you need to listen to me. So take your meds. Oh, okay, I guess I will. I hope this is something that you will never encounter in your practice, but unfortunately it does happen sometimes. We should never force a patient or never use our authority to manipulate a patient into taking medications they don't want to take. They have the right to refuse all medications if they want. Here's your Cardizem, 120 milligrams. The one I take at home is 180 milligrams. This medication error could have been easily avoided if the nurse remembered to do the 6 rights and check the MAR 3 times before administering. Here's your procardia, Mrs. Johnson. Okay, thank you. Okay, have a nice day. She's gone. This situation happens quite commonly when the patient doesn't want to take their meds, but they also want to appear to be compliant. So what'll happen is they'll pocket it, we call this pocketing, they'll pocket the med in their cheeks and then they'll spit it out later. In this situation, what the nurse should have done is stayed and watched to make sure that the patient has swallowed the medication completely. In some patients that you don't necessarily trust to take their medications, you might even have them go, ah, and stick out their tongue to prove that they've swallowed it. Hi, Mrs. Johnson, I have your 10 o'clock medications. Okay, thank you, nurse. I know, it's just been so crazy busy. I got 2 admissions and then they came up and they didn't have all the things that they were supposed to have, and I've just been running around crazy. I'm sorry I didn't get a chance to get in here at actual 10 o'clock. But here, you can take them now, that's totally fine. When you're giving a scheduled med, you have about an hour prior and an hour after that time to give it. If something happens and you are unable to give it at that time and within that range, you need to call the doctor and get it ordered for a different time, or they might change the dose or move things around. It's not safe for you to give it too early or too late. Here's your medications, Mrs. Johnson. The one I take at home is green. In this scenario, the patient was confused about the color of the medication. There are several reasons why the medication could be a different color, and you want to explain those to the patient. It could be because it's a different dose than they're used to taking at home. When you're hospitalized, sometimes the doctor will increase or decrease a dose based on what's going on with you, your current medical condition, or if they're giving you new medications in the hospital and we don't want them to interact. So that could be a reason. Another more common reason is it's just a different pharmacy. The pharmacy in the hospital makes the same medication, the same strength, but it's just a different color. It's still the same med. So explaining these things to the patient are perfectly reasonable and they should understand. Here's your Procardia, Mrs. Johnson. Okay, I don't really want to take them now. I'll just leave them here on my table and take them later. Thank you. Okay, just let me know if you need anything. Do you have your call light? Okay, great. When administering meds, we do have a certain time frame in which we are to give them. So if the patient says, oh, I'll take it later, and you walk away, you're not compliant with that time frame. So you actually need to stay there and have them take it in front of you so that they know they've taken it. So that was my video on some potential scenarios that could arise when administering medications. It was meant to be educational and a little bit silly. Obviously, I'm not making fun of the elderly. I would never do that. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.